Today we're going to break down what Xarelto is, how it works, and what conditions it's used for, and what side effects you need to watch out for. I'm Dr. John, board certified in internal medicine as well as geriatric medicine, and this channel is here to promote your health and your well-being. Think your health. Xarelto, also known by its generic name rivaroxaban, is a medication that helps prevent your blood from forming dangerous clots. It belongs to a group of drugs called anticoagulants, literally mean against clotting. Now, blood clots aren't always bad. If you cut your hand, you want your blood to clot and stop the bleeding. Sometimes clots form inside your veins or arteries where they shouldn't, and that can cause a serious problem. If a clot forms in your leg, that's called a DVT, deep vein thrombosis. If it breaks off and travels to your lungs, that's called a pulmonary embolism or PE. And if a clot forms in your heart or travels to your brain, it's also called a stroke. That's where Xarelto comes in. Xarelto is a drug that can thin your blood, prevent and treat blood clots. To understand that, imagine your blood clotting system as a long chain of dominoes. One protein activates the next, then the next, and a clot forms. Xarelto works by blocking one of the key dominoes, a protein called factor Xa. Xarelto slows down the clotting process. It doesn't thin your blood in the literal sense, but it makes it less likely for those dangerous clots to form. It's used for several different conditions, preventing stroke and atrial fibrillation. If you have atrial fibrillation or AFib, your heart doesn't beat in a regular rhythm. The irregular motion allows blood to pool and form clots. If one of those clots travels to the brain, it can cause a stroke. Xarelto helps prevent that by stopping clots before they form. So in people with non-valvular atrial fibrillation, Xarelto reduces the risk of stroke and other clot-related problems. The next big use is for deep vein thrombosis and pulmonary embolism. Let's say you have just had surgery, or maybe you've been sitting for long periods like on a long flight, and you develop pain and swelling in your leg. That might be a DVT, a clot in one of your deep leg veins. If that clot travels up to your lungs, it becomes a pulmonary embolism, a potentially life-threatening condition. Xarelto can treat both of these and prevent them from happening again. If you've ever had hip or knee replacement, a surgeon might prescribe Xarelto for a few weeks after surgery. That's because surgery, especially orthopedic surgery, increases your risk of clots forming in your leg. Xarelto is also used sometimes in combination with low-dose aspirin in people who have coronary artery disease or peripheral artery disease. In these patients, it helps reduce the risk of heart attacks, stroke, or blood flow problems to the legs. Now, no medication is without risks, and with Xarelto, the most important one to understand is bleeding. Because Xarelto interferes with clot formation, it can make you more prone to bleeding. That doesn't mean you'll bleed spontaneously for no reason, but it does mean even small cuts may take longer to stop. And certain types of bleeding can be serious. Let's break this down. Minor bleeding, this includes nosebleeds, bleeding gums when brushing, easy bruising, occasional heavy menstrual bleeding. These are fairly common and often not dangerous, but still tell your doctor if they become frequent or quite severe. Now there's more serious bleeding. Now here is where you need to be vigilant, like especially if you're vomiting blood or material that looks like coffee grounds, if you have black, tarry or bloody stools, pink or red urine, severe headaches or dizziness, weakness, numbness, or difficulty speaking. The last symptoms I mentioned you see in rarer cases, and it can cause bleeding around the spine, and this is called spinal or epidural hematoma. And these are medical emergencies, so call 911 here in the US, or go to the emergency room immediately. Let's talk about how to use it correctly, because how you take Xarelto matters as much as why you take it. Xarelto comes in different doses, 2.5 milligrams, 10 milligrams, 15 milligrams, and 20 milligram tablets, depending on your condition. Some doses are taken once daily, others twice daily, and some, especially the higher doses, must be taken with food to help your body absorb it properly. So always follow the directions your doctor gives you, not what you find online, not what your neighbor takes. Your dose is personalized for you. Now, this part is often overlooked. Xarelto can interact with other medications, over-the-counter medications, or drugs, and even supplements. One of the big advantages of Xarelto compared to warfarin, another blood thinner, is that it doesn't require dietary restrictions. You don't have to avoid leafy greens or vitamin K rich foods like spinach or kale. That said, there are a few things to keep in mind. Avoid grapefruit or grapefruit juice. They can slightly increase Xarelto levels in your blood, though not as dramatically as they do with some other medications. And limit alcohol. Heavy drinking can increase your bleeding risk. This is really important. If you're having any kind of surgery, dental extractions, or even a colonoscopy, you must tell your doctor or dentist that you're on Xarelto. You may need to stop it temporarily before the procedure to lower your bleeding risk. Never stop it on your own though, because suddenly stopping it can cause clots to form again. Your doctor will tell you exactly when to stop and when to restart it. Xarelto is processed through both your kidneys and liver, so your doctor will check your blood work before and during treatment. If your kidney function is reduced, a dose may need to be adjusted, or sometimes another anticoagulant may be safer. If you have significant liver disease, Xarelto might not be the best choice since your liver helps metabolize the drug. So let's look at some special situations like pregnancy and breastfeeding. If you're pregnant, planning to become pregnant, or breastfeeding, let your doctor know before taking Xarelto. There isn't enough data yet to know if it's completely safe during pregnancy or while nursing. Other anticoagulants like heparin may be preferred in these cases. So let's look at the 7 most frequently asked questions about this drug, about Xarelto. Number 1, what happens if you stop taking it suddenly? This is one of the biggest dangers I see. Some people stop taking Xarelto because they feel fine, or because they ran out, or they are worried about bleeding. But stopping suddenly can increase your risk of having a clot or stroke. So never stop without talking to your healthcare provider. Number 2, how long do you need to take Xarelto? It depends on why you're taking it. If you've had a DVT or PE after surgery, you might only need it for a few months. If you have atrial fibrillation, you might need to stay on it long term. In peripheral artery disease or coronary artery disease, the goal is usually long-term prevention too, but with lower doses. Your healthcare provider will personalize your plan based on your risk factors. Eliquis is a different medication. Yes, both are blood thinners. They both work by inhibiting factor 10A, and both do treat conditions such as atrial fibrillation, deep vein thrombosis, and pulmonary embolism. Note, dosing is different. Therefore, always be vigilant about the dose and frequency of your prescription drug. And if you're interested in a video on Eliquis, click right here. Number 4, do I need a blood test every month? No, that's one of the major advantages over warfarin. Routine INR checks, which are needed for warfarin, aren't needed. However, your healthcare provider might occasionally test your complete blood count to monitor your hemoglobin. Number 5, can I take it at nighttime? Yes, you can take it in the morning or in the evening, but stick to the same time every day. Consistency helps maintain steady levels. Number 6, which foods should I avoid? You should avoid grapefruit and grapefruit juice while taking Xarelto, as they can increase the risk of side effects. Also, watch out with alcohol, as it can increase the risk of bleeding, so it's best to limit your alcohol consumption. Number 7, how long does it take for Xarelto to reach its full thinning effect? It takes the medication about 2 to 4 hours to reach its full blood thinning effect, and it can leave your system within 24 hours. And if you found this video helpful, give it a thumbs up, and helps others find this video too. Subscribe for more easy to understand medical videos, and click right here or click right here. Have a good day and think your health.